Welcome everyone, Dr. Mandell here. I'm going to share with you some cutting-edge information about your heart on signs and symptoms that you can pick up early to help preserve your life as well as others. So why is this so important? Because there are millions of people worldwide who have high blood pressure, diabetes, who are overweight, who have poor diets. And these are the cardinal reasons why this leads to cardiovascular problems. Number 13, sleep apnea, snoring or waking up during the night. Snoring and sleep problems like insomnia and sleep apnea, a disorder where there are disruptions in your breathing while you sleep. These conditions have been directly linked to heart disease and other cardiovascular issues. Episodes of sleep apnea, which can cause sleepers to wake up gasping for air, cause inconsistent sleep patterns that can be stressful on the heart. Number 12, irregular heartbeat. An irregular heartbeat is more formally known as arrhythmias, which means that your heart isn't pumping blood as its normal rhythm. While you can be relatively healthy and still have an irregular heartbeat, it is also an indication for heart failure or an impending heart attack. Arrhythmias is caused by the interruption of the electrical system that controls the heart. There are many different types of arrhythmias, some which indicate that your heart is failing, although many arrhythmias are non-threatening. Number 11, random bouts of cold sweats. Sweating is a natural, healthy function the body goes through to cool down itself. Sweating, especially cold sweats, may be a sign of a problem with your heart when you're not doing any sort of physical activity, particularly when there's chest pain associated with it. The sweat is your body trying to cool down the inflammation around the heart. Number 10, indigestion. One of the symptoms of heart disease is indigestion. Indigestion is that full, uncomfortable, and burning feeling in your stomach that you feel during or after eating. Although indigestion could be a result of ulcers, gastroesophageal reflux, gallbladder disease, as well as other conditions, although it is found out that it could be a sign of heart disease as well. So if you're uncertain to where the cause is coming from, consult your doctor and be precise about where you're feeling the pains and bloating. Number 9, chest pain. Chest pain is a classic sign of a heart attack. Yet many people don't realize that this is a medical emergency. If you're feeling heaviness, tightness, or pressure in your chest, or people will often describe it as an elephant sat on your chest, or it feels like a tight band around your chest, this is the time to get to a hospital as soon as possible. Number 8, arm pain, jaw pain, or back pain. Many of us may not associate arm pain with our heart, but this can be a sign of a heart attack. If your pain is going down the arm, especially the left one, or into the upper back and neck, and even the jaw, this is more likely to be heart-related than indigestion. Number 7, swollen ankles. This should never be ignored, especially if the ankles get really big. That could be a marker for heart failure. Swelling in the lower extremities can be caused by poor blood flow. When blood backs up into the veins, it pulls and causes bloating. Heart failure can also make it difficult for the kidneys to remove water from the body, causing sodium levels to drop dangerously. Number 6, extreme fatigue and exhaustion. Feeling tired all the time can be a symptom of heart failure, as well as other conditions. But if you feel tired and you've been working long hours or staying up late, it's probably not your heart. But if you're experiencing extreme tiredness and your lifestyle hasn't changed, it's a good idea to follow up with your medical doctor. Number 5, difficulty breathing and dizziness. If you feel like you've just run a marathon, but you only walked up the stairs, that might be a sign that your heart is not able to pump blood to the rest of the body. Shortness of breath can occur with or without chest pain, and it's a common sign of a silent heart attack. So if you're having trouble with tasks that weren't previously difficult, such as doing your regular chores, then this can be a subtle sign of a heart problem. And if you notice shortness of breath after lying flat or shortly after lying down at night, this can be a sign of fluid retention and a weak heart. Number 4, leg cramps. The majority of leg cramps are idiopathic and harmless, but some may result from underlying illnesses such as diabetes or peripheral artery disease. This is commonly seen with atherosclerosis, plaquing within those arteries. So if you're having leg pain or difficulty walking, that can be a sign that your circulation is impaired. Number 3, erectile dysfunction. For the many men, this seems to be a very common problem, although there are other conditions that can cause this problem. This disease process can be an accumulation of cholesterol-filled plaque inside the arteries. Plaque will inhibit the blood flow through the artery that can commonly lead to this particular condition. So erectile dysfunction can be an early warning sign of heart disease or other circulatory problems. Number 2, change in skin color. Oxygen flows through blood vessels to get to all the cells, tissues, and organs of the body. When there is a blockage in a blood vessel, this will disrupt the blood circulation, which produces paleness or a gray tint to skin tone. So when you're experiencing a lack of oxygen, your blood may still be flowing, but it changes color. This causes the skin to become blue or gray in color. And number 1, you continually feel sick to your stomach. Now there are many things that can cause us to feel sick to our stomach, but our nervous system sometimes confuses signals coming from various parts of the body. The nerves in your gastrointestinal tract are closely intertwined with the nerves from the heart. As a result, a problem that could be brewing in your heart can sometimes translate as stomach discomfort. There's a way to tell a stomach bug from something more serious. Usually nausea caused by an impending heart attack will get worse with physical exertion and ease up with rest. So if you, a friend, or a loved one experiences any of these underlying conditions, it's always wise to get it checked out with a medical physician as soon as possible. Please share this video with your friends and family. Leave your comments below, and most important, make it a great day. I'm Dr. Alan Mandell.